DNA's podcast series, Let's Talk About Kidneys, provides education dedicated to exploring the journey of those living with chronic kidney disease. We're here to inspire meaningful conversations and to help people living with CKD gain a better understanding of their disease. Kidney stones are very common, affecting approximately 1 in 5 males and 1 in 10 females by the age of 70. Today, we will discuss what kidney stones are, what causes them, and how they can be prevented and treated. Dr. Grandhi joined Dallas Nephrology Associates in 2020. Dr. Grandhi is board certified in internal medicine and nephrology, and is also the director of DNA's Polycystic Kidney Disease Center of Excellence program. She currently sees patients at our Irving and Las Colinas office locations. She helps patients with various kidney disorders, including kidney stones, polycystic kidney disease, chronic kidney disease, uncontrolled hypertension, protein in the urine, and electrolyte issues, among other problems. Welcome to the Let's Talk About Kidneys podcast. Dr. Grandhi, can you kick off the podcast and first give us the baseline understanding of what are kidney stones?
Thank you so much for having me, Tiffany. So kidney stones, also called nephrolithiasis, as the name implies, these are basically small stones that are forming in the kidneys. These stones are usually composed of salts and minerals that are normally present in the urine, but sometimes they clump together, crystallize, and over a period of time develop into kidney stones. They're usually seen when the urine is very concentrated. Okay, they're extremely painful to pass. So, once you have a kidney stone, nobody wants to have a kidney stone again. But we do have measures that we can take so that people don't develop kidney stones in future.
Okay, and so what are the different type of kidney stones?
So yes, there are two main different types of kidney stones. They are calcium-based stones and they are non-calcium-based stones. Calcium-based stones, they come in two variants. Most common type of kidney stone is a calcium oxalate stone. In this, both the calcium and the oxalate, they combine together in the urine, usually forms in an acidic urine. They crystallize and they form kidney stones. People are not drinking enough water, they have a concentrated urine. They have too much calcium and oxalate in their urine that results in the formation of calcium oxalate stones. Calcium phosphate stones happen more commonly in alkaline urine.
Okay.
The calcium and the phosphorus combine together and they form calcium phosphate stones. Similar to calcium oxalate, these patients also have high calcium and phosphorus in their urine, but they tend to have alkaline urine. So coming to non-calcium based stones, the most common is uric acid stone. It has become very prevalent now because of increase in people being overweight and obese and having issues with insulin resistance. All of these, it causes acidic urine. There's a high production of uric acid in the urine that causes the uric acid to crystallize and resulting in the formation of uric acid stones.
Okay.
The two less common types are struveite stones, which forms in alkaline urine, and it's associated with recurrent urinary tract infections. There's a rare form called cystine stone, which is a genetic condition. It tends to run in the families. It is super important to know what type of kidney stone you are forming because the causes could be quite different.
Okay.
And prevention depends upon what kind of kidney stone you are having.
Okay, and so can you give us a couple of examples of what causes the kidney stones?
Yes. So as we discussed, it's an imbalance. Kidney stones happen because of the imbalance between the fluid and the various salts and minerals in the urine, right? So if people are not drinking enough water, they form a very concentrated urine that predisposes them to have at a high risk of having kidney stones. If you have somebody in your family who has a kidney stone, like a mom, brother, a child with kidney stone, you're at a high risk of having kidney stones.
Okay.
Certain lifestyle behaviors are associated with kidney stones. If you eat too much salt in your diet, the kidneys have to filter the salt in the urine and the salt drags calcium along with it. And as we discussed, calcium-based stones are the most common type of stones. If you eat too much animal protein in your diet, that causes an acidic urine that can increase the risk of formation of both calcium oxalate and uric acid stones. If you take too much of over-the-counter supplements, things like high doses of vitamin C, curcumin, they get converted to oxalate, and that can increase the risk of formation of kidney stones. If you are taking a lot of Tums for acid reflux or heartburn or anything like that, that can increase the risk of formation of calcium-based kidney stones. So it's a combination, I would say. It could be because of genetic reasons, because of your lifestyle behaviors. Sometimes you could have an underlying condition, medical conditions, which can predispose you to have kidney stones.
Wow.
Things like hyperparathyroidism. We have 4 glands in the neck called parathyroid glands. They're adjacent to our thyroid gland, and they regulate the calcium and phosphorus balance in the body. Sometimes one of the glands starts overacting, and it starts leaching too much calcium from the bones, and the kidneys have to filter this calcium in the urine, which puts you at risk of having kidney stones. Conditions like gout. These people have a lot of uric acid in their bloodstream, so that can cause gout and kidney stones. Things like obesity, type 2 diabetes, pre-diabetes who have insulin resistance, they tend to form uric acid stones. Inflammatory bowel disease like Crohn's disease, ulcerative colitis, and they can, because of loss of output because of multiple diarrheal episodes, they lose a lot of fluid in their stool. So they have a very concentrated urine, and that can form kidney stones.
Okay, so can you describe what are some of the symptoms that someone should look for to see if it's an indicator that they have a kidney stone or one that's forming?
Yeah, absolutely. So sometimes kidney stones can be completely asymptomatic. They were found as an incidental thing when patients have undergone an ultrasound of the abdomen or a CT scan for some other reason. For sometimes patients can present with what we call as renal colic. Here patients come in with severe pain in their flank, that is the area right in the back below your rib cage.
Does it matter which side, or does it happen on both sides?
It depends on which side the stone is passing through the ureter. That's what causes the renal colic. So this pain starts in the flank and it goes into your lower abdomen or into the groin. This usually happens because there is a tiny tube that connects the kidney to the bladder called ureter. When the stone is passing through the ureter, it causes ureteral spasm. That's why patients experience this severe pain. This can be associated with increased frequency of urination, urinary urgency, sometimes blood in the urine, nausea, vomiting. So there are 2 ways of presenting. Either they could be seen as an incidental finding, or patients could present with classic renal colic.
Okay, classic renal colic. All right. And so how are kidney stones actually diagnosed?
Yes. So when a patient comes to our clinic with a kidney stone, we go through their history, what kind of medical conditions they have, which is kind of like predisposing them to have kidney stones. Super important to know their dietary history. How much water are they drinking? Are they following a low salt diet, or they're eating too much salt in their diet? Are they eating too much animal protein in their diet? Are they taking any supplements which is predisposing them to form kidney stones? We do some blood work to check their kidney function and few other things like calcium level, uric acid level in the bloodstream. Most important test once a patient forms a kidney stone is a 24-hour urine collection. This gives us a lot of information about how much urine volume they are having. What is the concentration of the various salts in the urine? Like what is their urine calcium level, oxalate level, uric acid level, phosphorus level, citrate level, and urine pH. As we discussed, certain types of kidney stones like calcium oxalate and uric acid stones are more common in acidic urine, and calcium phosphate stones are more common in alkaline urine. Coming to the imaging, we usually do a CT scan of the abdomen to see how many kidney stones they have and how big they are.
So people can have multiple kidney stones?
Absolutely.
Oh, wow.
Absolutely.
Oh, I know that's painful.
Very painful.
Oh,
So usually pain happens when they're actually passing the kidney stone. Sometimes they can be there, but they're not having much symptoms. As I said, they could just be diagnosed incidentally. So it gives us the number of kidney stones. It also gives us the size of the kidney stones, because to see if they need any procedures to take the stones out. It also shows us if any of these stones are causing obstruction to the kidneys.
Okay. So for individuals that are either watching or listening, what can they do to prevent kidney stones?
Super important is, there are general measures and there are specific recommendations for individual type of kidney stones. General measures are increasing the water intake. Number one, hydration.
So when you say increase the water intake, what would be like the minimum ounces per day? I know people walk around with their water jugs and with the ounces listed. So what would be a good minimum amount to help with prevention?
Yes. So I recommend people to have at least 100 ounces or 3 liters of water on an everyday basis. And because we want a urine output over 2.5 liters per day, because the water will help to dilute these minerals and salts and reduces your risk of formation of kidney stones. It is hard for people to increase water intake in the beginning, but it is a habit. You just have to keep doing it. I always tell patients to buy one of those 1 liter water bottles so that they fill it up 3 times and they know that they have had enough water. One of the telltale signs that you can look for if you're drinking enough water is your urine clear or just light yellow in color. That means you are drinking enough water. Some patients tell me, Doc, I don't like water. What am I supposed to do, right? So I recommend adding flavoring agents like Crystal Light, or adding like cucumber slices or lemon slices or orange slices to the water, just to give some flavoring and, drink water. What is a side effect? You're going to pee a lot because you're drinking all this water. But, you have to understand you don't want to have a kidney stone again.
Have to urinate often than opposed to having to pass a stone.
Pass a kidney stone again.
People got to choose their battles.
Yes, exactly. So another important thing is lowering the salt intake in your diet. A lot of processed meals have a lot of salt in them, right?
In everything.
So once you start looking at nutrition labels and things like that, and you keep a track of your salt intake, it's just unbelievable of how much salt is there in processed meals. Second thing is eating out at restaurants, takeout places multiple times a week. Not good for general health, not good for kidney stones. Start taking food from home. Cut back on eating outside, A third general recommendation, I would say, would be to reduce your animal protein intake, like red meat, chicken, seafood. I recommend my patients to try plant-based diet, like go meatless Mondays. Start off with 1 day per week and then go up to maybe 2 days a week or so. It's not hard. It's just a change in how you're eating.
Right, and it's a necessary change.
Exactly. Be very careful about over-the-counter supplements. Don't take any over-the-counter calcium tablets and things like that. But a super important point is don't restrict calcium in your diet. When you restrict calcium in your diet, you actually end up forming more kidney stones. So don't restrict calcium in your diet. The reason being the calcium in your foods binds to the oxalate and helps to get rid of it in the stool. So it actually reduces the risk of formation of calcium oxalate stones, but don't take supplements. And then coming to specific recommendations of different type of kidney stones. For calcium-based stones, in addition to increasing the water intake, lowering the salt intake, we use medicines called thiazides. These are actually blood pressure medications.
And so these are a part of treatment?
Correct.
Okay, awesome. We can expand on that too.
Yeah. So the thiazide diuretics, one of the side effects of these medicines is they lower the calcium in the urine. So we use that to our advantage in our kidney stone patients. They reduce the calcium excretion in the urine and reduces the risk of formation of calcium-based kidney stones. For people who are forming more of uric acid stones, we ask them to reduce their animal protein intake in addition to increasing their water intake and reducing the salt intake. We use medications like allopurinol, which reduces the production of uric acid by your body. So the uric acid in your urine goes down. And as we know, it tends to form more in acidic urine. We use certain medications like potassium citrate, sodium bicarbonate, which helps to alkalinize the urine and reduce the risk of formation of uric acid stones.
So, Dr. Grandhi, can you tell us how kidney stones are actually treated?
Yes. So, if a patient is coming in with an acute renal colic, that means remember the pain that they were having in their flanks, going into their groin, and all that. But they are pretty stable, they're able to eat and drink okay. We use pain medications to control the pain, give them some nausea medicines, and we use a medication called tamsulosin to help them pass the stone. But if a patient is presenting with such severe flank pain and they're not able to keep anything down because of nausea, vomiting, we ask them to come to the emergency room so that we can place an IV line, give them some IV pain medications, give them some fluids, and give the tamsulosin so that they can pass the stone. If they are having a very high fever along with pain, I always recommend them to come to the ER because there's probably an infection and there's probably an obstruction that's happening which has predisposed them to have infection. They need and immediately to be seen by urologist to take the stone out. They need to be on IV antibiotics. If they are coming because they have multiple stones but they're not in pain right now, then it depends on the size of the stones. If they are less than 5 millimeter stones, usually patients are able to pass the stone by themselves by increasing their water intake, reducing their salt intake. And if they are acutely passing the stone, we give them that tamsulosin medication to help pass the stone. If the stones are between 5 to 10 millimeters in size and they're proximally located very close to the kidney, not close to the bladder, they usually end up needing a procedure to take the stone out. That's when we refer them to our urology colleagues. And if they're over 10 millimeters in size, very unlikely that they will pass the stone. So we will be referring them over to our urology colleagues to do certain kind of procedures to take the stone out. Our urology colleagues can do certain procedures like shockwave lithotripsy, where they use laser treatment or sound waves to break the stones so that the patients are able to pass the stones. Sometimes they do something called as ureteroscopy, where they put a camera into your bladder and then go up along the ureter to take the stone out or break the stone so that the patients can eventually pass the stones. Sometimes they do a procedure called percutaneous nephrolithotomy. So these are for large stones over 20 millimeters, where they use a tool, directly go into the kidney and take the stone out through an incision.
And so can you give us an example of maybe a patient that you've treated with kidney stones, whichever type?
Yeah, absolutely. So I had this 45-year-old gentleman who came to my office referred by his primary care physician because he was forming kidney stones almost like every 2-3 months.
Oh, wow.
Yeah. His stones, he brought me a stone for analysis and it turned out to be a calcium oxalate and a uric acid stone. So he had both. So on further questioning, he told me he was training for marathon and he thought he was drinking enough water. But when you're training for marathon or you're working in hot weather conditions, you tend to lose a lot of salt and water through your body. So your urine can be very concentrated. When we did a further analysis of a 24-hour urine collection on him, he was eating a lot of salt in his diet. His urine output was around 1500 ml, and we usually aim for over 2500 ml.
Okay.
Because he was losing a lot of fluid through his sweat. His urine calcium was very high. his urine pH was low. He had an acidic urine, and his uric acid was super high because he was eating a lot of animal protein because he was training.
Yes.
Yeah. So we worked with him, to increase his water intake. He cut back on his salt intake tremendously. He stopped eating out at restaurants, takeout places, and all that, started eating more at home. Cut back on his animal protein intake, started incorporating more of plant-based diet. I had to put him on a couple of medications, the thiazide diuretics that I discussed with you to reduce the calcium in the urine, and also potassium citrate to alkalinize the urine to increase the solubility of the uric acid. And he's doing wonderful. He's been stone free for the last 2 years.
Oh, that's awesome. Dr. Grandhi, this has been so informative and such an awesome topic to discuss. We thank you so much for your participation and being here with us today. Did you enjoy your time?
Absolutely. Thank you so much for having me on this podcast.
Of course.
I loved it. Thank you.
Awesome. Thank you. Thank you, Dr. Grandhi, for your participation today and for improving our patients and their families' understanding of kidney stones. Please keep in mind that people can develop kidney stones even if they do not have kidney disease. If you have kidney stones, your doctor will create a treatment plan that may include changes to your diet and medications to help lower your risk of forming more stones. There are many treatment options available, including general advice and specific recommendations based on the type of stone that you have. We hope you found this podcast helpful and informative. Thank you for joining us today. To learn more, call 214-358-2300 to schedule a consultation. Thank you for joining us today. For information about Dallas Nephrology Associates, please visit our website at dneph.com. If you found our information helpful, feel free to share it with others who may also be affected by chronic kidney disease.
Dallas Nephrology Associates' DNA podcast series, Let's Talk About Kidneys, is provided for general information purposes only and does not replace the need to talk with a healthcare professional about your unique situation, care, and options. Our goal is to provide you with as much information as possible so you can be as informed as possible. Reference to any specific product, service, entity, or organization does not constitute an endorsement or recommendation by DNA. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity or organization they represent. The views and opinions expressed by DNA employees, contractors, or guests are their own and do not necessarily reflect the views of DNA or any of its representatives. Some of the resources identified in the podcast are links to other websites. These other websites may have differing privacy policies from those of DNA. Please be aware that the internet sites available through these links and the material that you may find there are not under the control of DNA. DNA shall have no responsibility for the accuracy, legality, or content of the external site or subsequent links. Contact the external site for answers to questions regarding its content. The resources included or referenced in the podcast and on the website are provided simply as a service. DNA does not recommend, approve, or endorse any of the content on the linked sites. The content provided on this website and in the podcast is not medical advice and should not be used to evaluate, diagnose, treat, or correct any medical condition. The content is solely intended to educate users regarding chronic kidney disease, end-stage renal disease, ESRD, end-stage kidney disease, ESKD, and related conditions, and ESRD, ESKD treatment options. None of the information provided on this website or referenced in the podcast is substitute for contacting a healthcare professional.